Hello everyone, I am Dr. Satyanarayana Garre. I am a consultant nephrologist, transplant physician and intervention nephrologist at Apollo Hospitals, Jubilee Hills, Hyderabad. Today we will be looking at some common myths on kidney failure and what are the common misconceptions in kidney failure, and we will try to clarify those things. It's a myth. Kidney disease is one of the most common causes of the disease burden in India, and when you look at the mortality because of overall mortality, kidney disease is one of the most common causes of mortality in India. It's a myth. Kidney disease is not a rare condition. When we look at the data from the Indian subcontinent, the incidence of kidney disease, which is named as chronic kidney disease, is as big as 17%. And when we look at the statistics, which was out in 2015, the incidence has increased by more than 30 to 40% because of the better screening and better diagnosis. It's partially correct, but it's a myth. In majority of the cases, you will not have any pain and any other symptoms until the kidney stages reaches the final stage. But in some cases like renal stone disease and infections and any swelling in the kidney, you can have pain, but the incidence is not always true in all the kinds of kidney failure. It's a myth. The kidney disease can be identified by simple screening tools like a complete urine examination and a simple blood test by doing a simple creatinine. Most of the patients who are suffering from long-term ailments like diabetes and hypertension needs to get screened at least once in a year or twice in a year with urine examination and serum creatinine, and it can be identified in early stages. It's a myth. We can do a lot of things when we are suffering from long-term ailments like diabetes and hypertension. So the better things is lifestyle changes by doing regular exercises, diet control and restricting your protein. And once you have identified as chronic kidney disease, there are certain medications which can be used to prevent the progression of the kidney disease. It's a myth again. Majority of the time, the cause of kidney disease, the chronic kidney disease can be identified, and the leading cause of chronic kidney disease in India and worldwide is diabetes, followed by hypertension, and the least common causes are glomerulonephritis, hereditary kidney disease, and renal stone disease and autoimmune diseases. And a very small fraction of the population, we will not be able to identify the cause of the kidney disease, and that roughly accounts only to 5 to 10% of the chronic kidney disease patients. It's a myth again. Dialysis is one of the form for chronic kidney disease patients who reach the end stage renal disease. The better option is always renal transplantation, which has a better quality of life and better renal and patient survival outcomes. It's a myth again. In many forms of kidney disease, you will not pass any amount of urine. So in some forms of the kidney disease, you will pass some amount of urine, and in some forms of kidney disease, there not be any change in urine output. Now, depends upon what is causing your underlying kidney disease, the amount of urine you are producing is going to be decided on. This is partially right, but the amount of water which you need to consume depends upon your climatic conditions, where you are staying, and what kind of job you are into. And for example, if you are a person who is doing an outdoor job, you require more amount of fluids. But if you are a person who is sitting inside an air-conditioned room and doing a desk job, you require less amount of fluid. But on an average, a person who is working in climatic conditions like Indian subcontinent will require roughly around 2.5 to 3 liters, and if you are doing outdoor work, you need to take at least 500 ml of extra water. The better guide is always your thirst, so take a good amount of fluid to quench your thirst, and top on that you just need to add some amount of fluid to prevent dehydration. So just to put it across, the best form to identify a kidney disease is to screen early, and then the better way of avoiding kidney disease is staying healthy lifestyle, healthy dietary changes, and not taking unnecessary medications, and going for regular screening. especially if you are having any long-term ailments like diabetes and hypertension, and always opt for renal transplant if you are having any chronic kidney disease elements who are undergoing dialysis.